You look at all the successful treatments for trauma, they all involve getting close to the trauma-inducing mindset. Exposure therapy, gradual and assisted by a clinician, but rarely, if ever, are people with serious trauma encouraged to get as far away from the feeling of, at least not in the clinical setting. This has a lot of implications for things like trigger warnings. Colleagues of mine in psychiatry, I've asked them directly, what do you think of trigger warnings? And they said, there's some logic to it on the surface, but if you really think about true trauma, and we can define trauma, Dr. Paul Conti was on my podcast, is amazing trauma psychiatrist. He said, trauma is an experience, is not just a bad experience. Trauma is an experience that changes your nervous system such that it behaves differently in the future in a way that's maladaptive for you. So if you look at all the trauma treatments, they're all about learning to talk about the trauma, even experiencing some of the same feelings. So things like trigger warnings and all these things that buffer us against feeling our true feelings do nothing but prolong the trauma and prolong and exacerbate fear.